Lots of questions about the cost of dental implants. So what affects the cost?
Well, the number one thing is the way this is typically done, Randy, is that you go to one dentist to get the thing designed. You might go to a separate provider like an oral surgeon to get the surgery done, and then they will send out to a different lab. And so you have all these different things that add to the cost. But in our practice, we do it all under one roof. Your teeth are made on site at our office, and by
so you do the surgery.
I do the
and
surgery.
You make the teeth.
I make the teeth, the design of the teeth, everything from start to finish is designed in-house by us. We have control over every step of the process. So if there's any issues along the way, we can iron that out. The patient doesn't even know it.
Is that a bit unique in the industry?
Yeah, I would say that there are some other practices around the country that do it this way, and I believe this is the best way to do it because we have 100% control over the costs involved. If anything needs to be done, we can do it. We can absorb that into the cost for the patient. They're not paying 2 or 3 different people. You don't need to worry about.
So one doctor, one fee.
One doctor, one fee.
Okay, good.
Yeah.
What else affects the cost?
Well, I have the sheet here, Andy, because I don't want to leave anything out. So
all right.
The other thing is the type of implant chosen. So there are, it's a very competitive market, especially in some of the bigger cities. And so people are using, as low cost implant as possible. Well, that's the foundation for your house. We use at our practice, our standard implant that we do is the gold standard of implants, Straumann implants. They're an amazing implant. They're the most expensive implants out there, but it's the most important.
But you were saying they're only like $400 more for the dentist.
Yeah, but
to get the best implant.
But if you're advertising some rock bottom price where there's no profit margin built in, you need to scrimp and save on every little part of the process, right? And so by doing that, it's kind of misleading, isn't it? Wouldn't you want to give patients the best on every part of the whole process?
Okay.
So there's a little bit of bait and switching that happens.
Now you teach other dentists, so
Yes.
what you're teaching them is what we're talking about right now as well.
Absolutely, yeah. Digital workflow, full digital protocol. Putting in extra implants for, you want to make sure that if they ever lose an implant, they're not going back to square one.
Okay, good.
Absolutely, yeah. So the type of implant is a big deal. So we're using, you're getting good implants with us. You have a choice over a couple different brands if you want to, but we want to make sure that the foundation of the house is good, okay?
All right.
Don't scrimp on that kind of thing, and I see it all the time, unfortunately. And so sometimes patients suffer the consequences that you choose the wrong implant. The other thing is the lab bill. The lab bill can be very expensive. We give patients the absolute best material out there. So we use zirconia. So, a fake diamond is a cubic zirconia. So I call these diamond teeth. They don't absorb things. Unfortunately, what I see, I get a lot of patients that will come to me after they've already gone to some place like Las Vegas because they saw a cheaper price and they decided they want to go down there. Well, after a couple of plane tickets down there and the problems they're having, it's not so cheap anymore, and it ends up being more expensive than if they just came to me.
So these zirconia teeth that you're using, they don't stain?
They don't stain. So the problem is a lot of the low-cost people, if you go out of the country or something like that, they're using denture teeth. The denture teeth break, they're not hygienic, and here's what you have to understand about all the other things other than zirconia. They're porous, they absorb things, they absorb stains, they absorb bacteria, they absorb fungus, and eventually water, odors, everything, and they have to be redone and stripped, and they break off. Zirconia is highly hygienic. I mean, it is typically when I take these arches out of patients after a year, they're perfectly clean on the bottom. We use it for our final crowns.
Because things don't stick to them?
No, nothing sticks to it. They're beautiful. It's like a very, very, very strong porcelain. So, we don't have stain and things like that on these things.
So logically, this makes sense.
This is the best
Why
material.
isn't everyone doing it this way?
Because they don't have the lab. They're having to pay extraordinary lab fees, okay? What happens if they design the teeth, but they don't love the way they look? They're not going to go pay that giant lab fee again for the patient. They're just going to say, well, it's good enough.
So if you don't like it, you just press a button and
if I don't love their teeth, I throw their arch away and we make a new one because I have invested heavily in our lab. We have $1 million lab attached to our practice. And so if I need to remake the teeth, I don't pay the same fee as other people do. So that helps me control the cost for the patient. But it also allows me to not have to worry about if, there's times when I end up, maybe they had more gum pullback than we thought they were going to have or something like that, and there's now gaps under there or something like that. Not every case is the same. I have the freedom to remake that case the right way because I don't have this extraordinary lab fee from an outside
all
lab.
of these things
And by the way,
cost.
our lab makes better restorations than 99% of anything I see all around the country. I'm very, very proud of our lab.
Okay.
I've invested heavily in our training, we have the nicest mill in Alaska. We have the nicest implant lab in Alaska, actually. So we're going to start making some work for some outside dentists, but right now it's just us that are doing it there. But it's incredible. So having that all under one house is a huge deal for the patient at cost control. But also, you get 3D printed prototype the day of your procedure. I'm not punching holes in dentures. Dentures are expensive, by the way.
So the way it's typically done is you just get...
They make a set of dentures, and then what they do is they have the patient wear the dentures, then they'll do the surgery, and then they punch holes in the dentures, and they grind that denture up, and they do this acrylic pickup thing, and they end up with just some dentures bolted in their mouth for a couple months. Well, we go straight to the 3D printed prototype the day of, and I can print as many prototypes as I need to. Any changes the patient wants. They don't like the canines weren't sharp enough, anything. I don't care. I love it. I want them to dial it in. I don't care how many temps I have to do. It costs me hardly anything to make them a new set of temps, get them reprinted. We can modify it digitally. You know, we're not making these all by hand like a denture where you have some guy out there putting every single little tooth in. We can take the digital file, we can tweak it each time. I can print it. It's not that much. And then we put it back in, and we always do that until they're absolutely ecstatic about their teeth. So that is a huge part of this. Like, I would never send anyone in my family to any place that didn't have their own in-house lab.
Is that very telling about the doctor too? That means when choosing an implant dentist, if they have the...
If you're going to do this, you want to go somewhere where the doctor is all in. I'm all in. I have every single toy there is to do with this, whether that's digital force measuring equipment, bite measuring equipment. It's really important how you build a bite on this. So some of these places you go, you fly out of state, and if the bite's not built right, the implants will fail over time, or you'll have problems with the prosthesis breaking. We have all of the equipment we need. I actually teach on this digital protocol.
So how we're talking about how the teeth come together. Is that what we're talking about?
The way the teeth come together, so that
it's important.
They have to be balanced for your jaw health. I have patients. I have one of these patients who came in here, and she said that the other side effect she noticed is that her TMJ went away. She was having clicking and popping in the jaw, but now that her bite was fixed, and that's really important, the way the teeth come together, her jaw pain went away.
That comes from experience.
That comes from experience. That's the hardest part about this profession. It's not putting the screw in the bone. It's how you design the actual part that goes on top. Very, very important. There's a whole art. It's the biggest thing in dentistry. If you ever heard of the word occlusion, dentists get into major fights about
what does that mean?
Occlusion is how those teeth mesh together, glide with your jawbone, function in harmony
that's a big
with
part
your
of
face.
this.
That's a huge deal. And that is where I see people, unfortunately, cut corners. And the patient may not know right away, but 5-10 years down the road, that's when those things start to show up. So it's really, really important that you don't rush
they break?
Well, we could take shortcuts. We could do this in 2 visits.
Okay.
Right? But I really care. I want to see this patient 15 years down the road at the grocery store wearing these teeth. And so I'm not going to cut corners on this patient, even if they want me to. I'm going to make sure that we build it right.
It doesn't cost more to do it right.
No, to do it right. You want to do this once. You want to do it right the first time. So
what else affects the cost?
Insurance coverage, dental insurance, notoriously terrible. I mean, most dental insurance, I tell patients it's a $2,000 coupon. That's it. That's all it is. We do have some insurance companies in state, like Aetna, State of Alaska, that will cover a majority of this.
So Aetna, state employees, how does that work?
They kick it to medical, and so that's an awesome, by the way, if you have that, good for you. We love those ones because they cover about 80+% of this procedure. So definitely, even if you think you can't afford it, but you have Aetna, State of Alaska, come in and see us, please.
But Medicare, Medicaid, I mean, they're not going to cover that
Medicare and Medicaid doesn't cover it. So generally, most people will finance this, and we have really great financing.
You have to have okay credit.
You got to have okay credit. You got to have okay credit. Yeah, absolutely. Yeah, if you have terrible credit.
You told me like 9 out of 10, not just in your practice, but across the country,
I think
are getting financed.
Yeah, I mean, it's not a cheap thing to do, right? So most people finance it. Just like if you got a car, you'd finance it, most people. So if you can qualify for financing a new car, you're probably going to get qualified for this too. When we see these ads for low-cost dental implants in some of these places where people will travel to places like Las Vegas or whatever, or Mexico, it's kind of frustrating for us because they're not really being honest with the patient.
What do you mean?
Well, they'll tell them that they're going to get implant teeth and they end up with a snap-in denture or something like that. And so, snap-in dentures are better than regular dentures, but
you don't like them.
Why? I don't like them because the patients don't like them. They still have a denture. They still got to get a new denture every 5 years. They're very high maintenance. They're coming in 4 or 5 times a year to get new snaps in there, new tops on them. And in the end, they end up losing bone just like they would with a denture. So yes, they're a lot more comfortable than a standard denture that's moving all around the place, but you definitely want to go to a bolt-in bridge if you can.
Now we're in California at this newsroom, and about an hour and 15 minutes away is Mexico.
Yeah.
And a lot of people are going there, and then they have to get it redone.
I love Mexican implants because it's my #1 referral source. Unfortunately, it's actually terrible because the patient comes to me and typically...
So you have to do it twice.
They have to do it twice. The majority of patients that come in, almost all of them, unfortunately, the implants weren't placed in the, it's important who you go to. They have to be placed in the right position. And so the number one thing that I see that causes the implants to fail is malpositioning of the implants. For whatever reason, a lot of these places you go, they don't leave enough bone on the outside of the implants. They're not positioned correctly. They put too short of implants in. They have high infection rates because their infection control is poor. So I see a lot of that where I end up having to take all the implants out. Just had one last week.
Ends up costing a lot more.
They have to redo it. So they paid half price to go to Mexico, but now they have to redo the entire thing again. And they don't go to Mexico the second time. They learn their lesson. They come back and they have to pay again, the normal price to get it done. It's really important. The most important thing is, I think it's misleading to tell patients that they can get this done and they never have to see a dentist again. It's important who you choose. You want to choose the person you trust to make sure. These can last an incredibly long time. These can sometimes last the rest of your life. But it's important that you choose a provider you trust that is good about teaching you how to take care of these things, how to use them, that kind of thing. And then that's when they last. You don't buy a Mercedes and then never get an oil change again. It's not going to last very long. So it's important not just to think this is one and done. And that's where I think there's a lot of misleading advertising on that kind of thing, where they think you just never have to be seen again. And unfortunately, those are the places that typically you have to be seen again because they have a high complication
rate. Now, anticipating this interview, we've done some research. I mean, like in LA, they have billboards that show like $295 for implants. As you've explained, that's like they're quoting the cost of that little tiny
one
implant.
Single implant. And
so
by
it's
the way,
misleading, right?
And it's really misleading because that implant cost them at least $295 just for the product out of the package. So what else are they lying to you about if they're misleading you on that? And here's the problem.
Because it's about the same wherever you go. I know your fees. It's about the same wherever you go.
We have a very fair fee for the lower 48.
But it's less if you can do it right the first time.
Listen, you want to do this once. That's where you're going to save the money. You do it right. I do this. I build things to last. I'm putting in extra implants. Most of my cases could lose 2 implants in the future per arch and get the same bridge put back in.
Now there's this term, I see it all over the internet, all on 4, that like getting full set of teeth on just 4 implants. You don't think that's enough implants?
You didn't see the second half of that term, which is all on 4, none on 3.
Okay.
So you don't have a 3-legged table or a 3-wheeled car because you're going to have problems, right? So unfortunately, that's another thing. Some of these big corporate places that want to do this have high complication rates because for them, every little implant, they're trying to save $300 for an implant, right? Or 2 implants, $600.
Okay.
Because they're looking at the bottom line of every little thing. Well, here's the problem. You get 4 implants, okay, even if they all go, there's a 5% per implant complication rate. But even if everything goes great, that doesn't mean that 9, 10 years down the road, they're not going to lose an implant. Well, if you're in an all-on-4, then you're starting over. The minute you lose 1 implant, you're starting over.
So how many implants do you use
I typically
for a full arch of teeth?
Yeah, so on the uppers, I normally do 8. On the lowers, I normally do 6. And it's different for every patient.
So it's engineered better?
Yeah, I engineer it. So when I'm freehanding these implants, I'm putting them in. I'm thinking about what if this implant fails? Where are its friends? So I'm engineering in my head, and every case is different. Where I thought I was going to put the implants, the bone might not be good there. So we're going in there. That's why I have training in advanced implant techniques where sometimes I'll use little islands of bone and things like that so I get really strong pilings. It's like putting pilings in the ground. I want to go to bedrock, right? I want to overbuild this thing so that you can put them in the day of the surgery and start eating on them right away.
Now
if you do an all-on-4 and the bone is too soft, all of the implants can fail. And so it's really important about the skill of the provider who does it, that they understand that you have to build it strong enough to take the abuse.
So is this like a philosophy and an approach to implant dentistry?
Absolutely.
Where just a couple of more implants makes all the difference?
Absolutely. You want it built
That's
right
your
the first time, 100%. Yeah. I want these patients to be able to lose 1 or 2 implants. Think about it. If you can buy yourself that time, let's say 20 years down the road, they lose an implant or 2. I now bought another 10 years for that prosthesis.
Okay.
Well, they would have had to start all the way over. That doesn't do them any good. But also, what's the stronger cabin? The one that's got 6 pilings underneath it or the one that's got 4, right?
Okay.
So that is the foundation for your house. So it frustrates me when I see these places and they're advertising rock bottom prices, but they're scrimping on the most important part, which is the foundation of your house. Build it right. Build it strong.
Now,
overbuild it.
I think you told me there's less bone grafting today than there was.
Yeah, so I used to do a lot
of
bone grafting. I got trained to do sinus lifts by the guy who invented it, Hilt Tatum, and I did a lot of sinus lifts, but I do less of that now because there's more modern implants now and implant techniques, something we call in the implant world remote anchorage, where we're finding that bedrock, islands of bone, where we can stand up a house the day of and actually make that thing extra strong.
So the days of not enough bone.
The days of not enough bone are gone.
In your hands is pretty
Absolutely.
much behind you.
I've had maybe one or 2 patients in the last 5 years that truly And that was because their mandible, there was nothing left, less than a pencil in their mandible. That's extraordinarily rare.
Is that right?
Yeah.
So if someone calls your office and they want to know how much your implants, it's not that easy.
No, I mean,
give them a price over the
well,
phone.
listen.
There's a catch,
Every case is unique, right? And so what I can tell you is that our prices are extremely fair for anywhere in the lower 48, which everything in Alaska costs more, right? But because we do so many of these, because we have the in-house lab, we have a very fair price. But the other thing is, you get all my love and attention, and I want to make sure that I'm going to see you around town. I need to make sure that that thing's holding up for you.
And you guarantee your
I'm
work.
not a corporation on Wall Street that doesn't care what happens, and that's the unfortunate thing when you do travel and you're going to other places for this thing. They don't care. You're just a number. You go to the cattle car and they want to crank it out. They want to see you as little times as possible. I'm going to make sure that it's done right for you because I have to see you around the community, and I want to see that thing down the road still rocking and rolling.
You told me, by the way, in the green room, you say, Randy, it's not about the money. I love this.
No, it's amazing.
Why do you like it so much?
Because these patients are so happy, and they're literally changing their lives. I get to bear witness to the moment where they took back control of their life, and they tell me that it changes everything in their life around. They find love. They got a new raise at their job. They got a new job. Everything in their life can change from this procedure, and it's the most amazing thing.
So you're enthusiastic about this because of what you've heard and seen from patients.
I've never done, like I said, I've done every kind of dentistry, okay? And I'm very proud of a lot of the dentistry I've done, but I've never met patients who are more grateful than what you do for them because you take them from a life of misery with dental problems to where their problems went away. They come in once a year and they have an enjoyable visit. They look forward to coming to the dentist. And they're sending in their friends.
They want to come in for cleanings.
I mean, they're really taking their life back, and it's just an incredible thing. And I mean, it's really fun. I have never had a patient who hasn't said it was the best money they ever spent. Okay. They honestly, they're proud of their teeth. They smile more. It changes their interaction. Everything about their life can change just from this procedure. And I've never had anything in dentistry like this. It's incredible.
So start with the consultation.
Start with the consultation. We do a free consultation. You come in, you get a CT scan. If you're thinking about doing this, I encourage you to shop around, but come to us first because you're going to get a free consult, free CT scan. Okay. We'll talk for an hour. We'll talk about what's good for you and what will work for your case. And I'll be honest, and if I think you need to keep your teeth, I'll tell you. I don't take out teeth that don't need to be taken out. But let me at least take a look at you. Let's talk about what's possible for your case. I think you'd be surprised.